morning, Dr. Patino here at the Cosmetic Surgery Hospital. We're gonna do high definition liposculpture on a male. So a male is different, you know, and so we're gonna go ahead and be the first ones to, you know, to show you what you see here. And you know, usually males tend to bleed more. They have more muscle mass and stuff. So, but usually our look at that. Did you see it bleeding? That's, what color is that? That's incredible. And so even a male, we can do these white aspirate, but it has to do with the way we do these, how controlled my movements are, very, very slow. I think the speed is number one, you know, and also the fact that we waited over an hour before we start. That's also key. Slow my strokes are, right? I am extremely slow with my strokes, but and he's not gonna have a fat transfer. This is just gonna be high definition liposculpture. But even then, I think it's important to minimize risk and complications. Definitely less risk of anemia, right? Which is from blood loss. And if there is less anemia, then there is. Wow, what color is that?
Yellow fat.
And you know, another thing about going slow is that, you know, the risk of intra-abdominal perforation, you know, to put the cannula and damage some organs internally, you know, the intestines, the stomach or whatever, the liver, the diaphragm, is with this technique is pretty much, I would say, almost near zero or non-existent, because if you do it this way, because you're going so slow and you're so controlled, you know. Like, look at my movements. Look at my movements over here. See, very, very. Even though I'm going deep there, I'm pressing with my hand, going deep. My movements are very. There is no unintended stroke. In other words. Yeah, so I'm marking the iliac crest here, you know, and pressing down with my hand. Yet, you know, we never had anybody have a intra-abdominal perforation, thanks to God, or intrathoracic perforation, or any kind of organ injury, thanks to God, and we want to keep it this way, you know. But I am very, 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 very careful, extremely. I'm exaggerated when it comes to your safety, right? So that you don't have any issues like that. But it's like driving a car. If you go very fast, you know, you may run into trouble. But if you go slow like this, not only the aspirate is bloodless, but also you have less risk. Thank you. Wow. So look at this, huh? Incredible, huh? Thank you. Wow, so we are almost done with the surgery, maybe 20 more minutes. And look at the incredible, what is the output, you guys?
It's so yellow.
Yellow fat, huh?
Oh, yeah.
Like gold, right?
Yeah.
And he's not having a fat transfer or anything. But man, that fat is pure. See, even in patients like this, that we're not doing a fat transfer, we want to keep the blood loss to near zero, basically. That way they recover faster, they have more energy, they're going to walk more. In addition to that, the anesthesia that we give is going to last for 2 days, so they're going to prevent a blood clot.